So I like to call active adult boomer housing. And I think that speaks to the demographic that we're targeting. The boomer generation is very discerning. They are unlike the generation before them, the Eisenhower generation, the silent generation. It is the first time in our industry that we really need to understand what customization means. And that is what the consumer for active adult wants. They want curated experiences. They want a lifestyle that's customized to them. They're the first generation that has really understood what wellness and longevity is, that well span over health span. And all of those factors are coming into this very early infancy of active adult demand and creating what that lifestyle is around those curated experiences, customization, and health and wellness for the boomer generation. 80% of the healthcare spend is happening with 20% of the population. And so by the time an American senior gets to be 65, they're already battling 1 to 2 chronic conditions. As they age, if those are not managed, those chronic conditions are going to multiply. And that's when the real healthcare spend happens. I was recently last fall at the health conference in Vegas, the largest healthcare conference in the country. And I was listening to payers talk about how we really worked on in integrating a value-based healthcare system, quality over quantity. We're really starting to tackle that healthcare spend for chronic conditions that already exist. What we're not doing, though, is working on preventative care. And the health insurers, the payers know that this is a large looming problem. And especially as the boomer generation enters that age, they know that this is the largest generation we've ever had to tackle. And prevention is not a huge focus. Active adult is the first residential lifestyle setting that has the opportunity to bring in preventative health and wellness versus high-cost needs-based care of senior housing. And so active adult has the vast opportunity to work in the healthcare ecosystem to fill a gap, to really decrease the healthcare spend for this boomer generation if we address this very soon in the next couple years of pairing preventive health services with residential lifestyle. That's exactly what Avenue is doing with our Viva Bene Active Adult brand. Active adult is filling a need for residents that, quite frankly, they didn't know that they needed. Most of our residents in active adult have had life changes, spouse passed away, divorce, solo agers by choice. It's harder to take care of their home, or they're quite frankly busy. They're retiring and they have other activities that they want to do than continue maintenance of their home, cooking all the time. They want options to give them flexibility in life, which when you think about it is really what we all want. It's aspirational living of getting to that point in life that you can do that and make those choices. Active adult is allowing residents to do that in a lower cost setting than traditional senior housing that hasn't existed before. And so if an active adult community can be 30-40% below the cost of an independent living, and you still get a lot of socialization aspects, your freedom, all of these things that when a resident thinks about moving into senior housing, they think they're giving up freedom. With active adult, you don't have to give up your freedom. That is part of the lifestyle component of that. If you pair that with the operational efficiencies that we have of active adult, if I'm an investor that's been used to traditional senior housing, it's risky. It's a risky operational model. It's very labor intensive. It requires a lot of asset management time. In active adult, we do not have as much expense on the labor side as we do in senior living because it's far less staff, which means less operational risk and investment on that side. So right now we have this vast opportunity of pairing demand of the boomer generation that is seeing an aspirational lifestyle that they didn't know was around and could exist, along with huge influx of new investor interest into this space. And it's going to create an opportunity, if done right and thoughtfully, for a lot more active adult development in the coming decade. Viva Bene is the first active adult community, and also I would argue non-licensed care community. So active adult independent living that is truly focused on proactive versus reactive living. We are combining the socialization, the lifestyle component of a community setting like active adult with preventive healthcare services. When we first started this journey of Viva Bene, proactive healthcare really meant like primary care. Can we pair primary care services for our residents to help them live well longer in the comfort of their home? And what we have learned on this journey of almost 24 months now of operations, health means a lot more than primary care to our residents. It is really looking holistically at what they need to be healthy. We recently did a survey of our residents at Viva Bene of what health meant to them, and a lot of it was education. And that was a huge light bulb for us of saying, hey, we're not done learning on this journey. Education can mean a lot of things, like you think of traditional education of college or classes, but it's like health and wellness education. We are still learning a lot about how to be proactive about our health. And can I learn about that? Before I do, can I learn? The second was age-appropriate fitness classes. And so can we bring in partners, which we've recently done, to look at longevity and wellness from a physical standpoint that could be something that is done like safely, that might not be a fitness class, but what are daily movements that I can do? How can I increase mobility? So we've recently partnered with a group called Groove Health to do that. And then lastly, through our partnership with Sevi, we've looked at what's called a care coordination model, which is a fancy word in the medical space for what we call a well concierge. It's someone that can help bridge the gap for you as a resident with your healthcare questions, but also for an adult child to really help understand the nuances of your personalized healthcare journey with your doctor, with your primary care doctor, with your cardiac specialist, with your orthopedic. There are lots of integrations in the healthcare system that happen that don't have any bridge points. And what our well concierge does through Sevi is create those bridges with the providers that our residents have to answer those healthcare questions in between visits, and also just like daily concerns that we may have.